Hello and welcome back to the Out of Programme podcast. Today we're joined by Dr. Victoria Bakare, who is a GP, Associate Medical Director of Kent Community NHS Foundation Trust, and also the Clinical Director of Occuvia Health, which provides clinically led occupational health support for charities, NGOs, and other mission-driven organisations. Prior to this, Victoria also held a range of global health roles in the WHO, UN, and World Bank Group. So, Victoria, welcome to the show.
Thanks for having me. Excited to be here.
So we always start the show with the same question, which is, what got you into medicine?
Yeah, I've been dreading answering this question because my answer is not conventional. I wish I could say to you that I've wanted to be a doctor since I was a little girl, but I actually have a diary from when I was about 12 or 13, and I wrote down a list of all the things that I wanted to do, or all the jobs that I wanted to do. And it went something like be a lawyer or a barrister. I didn't know that they were two different things at that age. I wanted to be a manager. I wanted to work in a bank. And then I thought a little sentence saying, if things don't go too well, then I would settle with being a dentist. And if everything goes wrong, I'll be a doctor. So it really wasn't on the top of my list. It wasn't on the top of my list. I was all right at school. I did fairly okay. Never really that fond of sciences. So it really wasn't anything I ever really thought about. But my teenage years were quite transformative. I spent a lot of time in church. Faith is a really important part of my journey. And I spent some time praying about it. And I started to feel this nudge towards medicine, which in all honesty, I didn't understand because I had no interest. But that's how I eventually got in there.
Wow. I mean, that is truly a higher calling. But what was it like with, I suppose, your peer group or your family? Did you have any influences around you at the time?
Yeah. So, I mean, my dad, as soon as I mentioned even slightly that I could be interested in medicine, he just ran with it. The whole family knew I was going to apply for medicine. I hadn't even made up my mind. And even at that stage, I was really keen that the decision would be my own. So actually, I didn't tell him that I was going to apply for medicine. We were, going through that season where you apply for uni and things. I didn't tell anyone I was going to apply for medicine. I literally went to sit the last UK CAT available in the UK because I made the decision so late. I didn't tell him that I'd applied or that I'd done the UK CAT because I wanted it to be an independent decision. I didn't want external pressure. In my sort of immediate family, there weren't any doctors at the time, but I had an uncle who was a GP, and I did some work experience with him. I got some work experience at the time, but it wasn't enough really to strike up that passion in me. Anyway, I decided that I would just go ahead and apply, and somehow they let me in.
And I guess the rest is history.
Yeah.
So tell me a little bit about your experience then as a medical student. Were you a traditional, very focused on, becoming a doctor, or were you exploring some different things along the way? How did you approach it?
I honestly spent the whole time at medical school just avoiding medical school. I spent the whole time trying to find just anything else to do. One of the tipping points for me when I was going through this process about praying, if this is something I'm going to pursue, was I came across a book called Mountains Beyond Mountains by Tracy Kidder. And this book is about the life of Dr. Paul Farmer, who's passed away now in 2022. But it just spoke about how he went out to Haiti and how he did all of this really great international work. He was a medical anthropologist. And honestly, at the age of 16, 17, I had no idea that this existed. I didn't know that this was an element of medicine. So I remember exploring doing international relations because I wanted to do something global. But when I felt led to do medicine, I just thought, I want to make the work meaningful. I don't want to... And to be completely honest with you, at that age, I didn't really understand what I was getting myself into. I didn't know that medicine could be meaningful in its own way. That's something I discovered later. But at that stage, I wanted to find more deep meaning in whatever career path I chose. So reading that book and learning about Paul Farmer's work made me think, oh, actually, I can make something of this. So I spent all of medical school trying to do that, just trying to find that meaning and trying to participate and engage in activities that would be stimulating, that would mean I get to contribute to the bigger picture. So I basically ran away from medicine the whole time I was there. The majority of my work experience happened as a med student. All of my travel happened as a med student. I was definitely not your typical, for sure.
Was that a feeling that you had immediately when you started? Because it sounds like you already had some doubts about going into medicine. For example, you applied quite late to some of the key exams. When you then landed in medical school, was that feeling already there, or was it something that grew from the experiences of being a medical student?
It was absolutely already there. Yeah, I definitely came in wanting to make the most of it. And one of the great things about being a medical student, it's like an all access pass to just everything. If you tell people, if you knock on a door and you say, I'm a medical student, they just open the door for you and say, yes, come on in, come and learn, come and experience. And so I really use that to sometimes a fairly extreme extent. I use that medical student pass to really get into certain rooms and be in certain spaces. But I definitely came in knowing that I wanted to do more.
Mm.
And honestly, medical school is very it's very prescriptive. It's very you learn and you go through the motions. And so I hadn't really yet at that stage uncovered the rest of the meaning that comes with being a doctor. That started when I started working, when I started F1, F2. And then I was like, oh, actually, I do like this. This is meaningful work. This is great stuff. But I just didn't have that feeling whilst I was at medical school, which is why I just kept trying to run away, basically. I did okay. Don't get me wrong. I passed my exams. I did fine. It was a great experience. I definitely found my tribe in medical school. Joined back then it was called Medicine Students for Global Health is what it's commonly known as now, and I found my tribe with people who were also passionate about wanting to make change globally, wanting to impact health across the world. So it was a fulfilling experience at med school, but I can't say because of the medicine. Not really.
You mentioned that as a medical student, it helped you open doors. So can you talk me through a bit more of that? Like, how did you use your badge to identify opportunities?
Oh gosh, I pretty much did it from the very first year, actually. From my first year of medical school, I went to King's College London and there was the King Centre of Global Health. I think it was still quite a young centre at that stage. It hadn't been around for that long. And I literally just physically went to the office and said, hi, I'm a medical student. I'm really interested in learning more about global health. Can I do some volunteering? And actually, the volunteering, I don't want to call it trick. It's not a trick, but the volunteering offer is what has opened so many doors for me too, that and being a medical student, because there's a certain degree of trust that I think people have in medical students, that they have an assumption. They assume that you're hardworking. They assume that you're interested. They assume that you've had to work hard to get to where you are. So there's a trust that comes with that. And so I always used to offer myself as a volunteer. Through that, I then did like a 3-month placement in Zimbabwe with the Department for International Development. Then they were just piloting this program, and they used King's participants, and I was able to get onto that program and go out there and work with other medical students in Zimbabwe, some of which I still speak to and engage with now. And actually I carried on that work throughout medical school. So it's lots of different things. It's just being a medical student. I think, like I say, it comes with these assumptions. It comes with this, that this person has something, they've done something to get here. They've got a leadership quality about them, or they've got, a hard work about them. And so that's how I managed to use that to get into certain spaces and rooms.
And right from the beginning, it seems like you were searching for purpose. Did you ever question whether you would actually graduate medicine and become a doctor?
Every year, every exam, all the time. Do you know, I did the extended medical degree program at King's. And so just a slight segue, the extended medical degree program is designed for students who are living in inner city London. So I grew up in Southeast London, and I went to a fairly good school, to be fair. I went to a good school, but I was still in inner city London. I didn't go to a private school or grammar school. It was still a state school. And so the program is supposed to open up opportunities to students like me from these types of backgrounds to get into medicine. And in doing that, when I applied, they had lowered the grade boundaries for you to get in. And so I think all I had to do is get 3 Bs to get in. I did not do that. I did not get 3 Bs. No, I didn't. I did not get 3 Bs at all. And I was crushed because I just thought, I got this offer. The grades weren't that hard, but I really struggled with A levels. There's something about A levels that I had done well in GCSEs. I'd done well, all the way through, but A levels I really struggled with, and I was crushed. And I spent a lot of time praying and crying, of course, praying and crying, both of the two together. And I decided that even though I didn't get the grades, I was still going to go ahead and pursue medicine. At that point, I think I was most discouraged because I just felt like I thought this is what you wanted me to do. And now I've gone and done all my exams and I got the offer and I haven't got a place. What's going on? And then quite literally, so I submitted to resit papers and take a year out and do all of that stuff. And a week before I was due to start the course, had I got the grades, they called me and offered me a place anyway. And that was such a huge anchor for the rest of the time that I was there. Because I was like, you know what, I really do believe that I'm supposed to be in this place. I'm supposed to be here doing this thing. But it didn't come without imposter syndrome, because then I started medical school with not the grades that all of the sort of the traditional 5-year program had. They had A stars and A's and things. So it came with a lot of discomfort initially, thinking, oh my goodness, like I didn't get the grades. Can I really do this? But do you know what? To be completely honest with you, there were students who didn't finish medical school who had the A's and the A stars, you know? And so I was still able to push through, to persevere and to graduate. And that imposter syndrome, it really did follow me around probably until my sort of penultimate year in med school. I struggled with it quite a bit, yeah.
Wow. So if I was to just dig into that a bit further, it seemed like it was real touch and go. And I suppose it's fantastic to hear that you got a place. But how did that, I suppose, coming in with that feeling of imposter syndrome, how did then you approach medical school? Because as you mentioned, there are all these students who have, straight A's that you are essentially competing against with the way that medical school works, with the rankings and then with the junior doctor placements. I suppose I'm wondering if you had a different game plan. You certainly explored different things while you were there, but then how did that impact things like your motivation for exams, your approach to your studies? Can you just elaborate on that a bit more for me?
In all honesty, I think just about made me more motivated. I worked the hardest I've ever worked. And somehow it was easier than A levels. It was easier to succeed at medical school in comparison to A levels. I don't know why, but when you put the work in, the results most often tend to be there. So I was so motivated, not because I felt like I had something to prove, but I really I didn't want to dishonor the opportunity that I had. I wanted to make the most of it. I remember staying up to excessive hours in the evening and early hours of the morning in the library, studying in like the first 3 weeks of uni. We hadn't learned anything yet. So what was I doing there? So over time, I learned to sort of temper that and work out how to work smart, not just hard. But yeah, I think just having that experience made me think, do you know what? I'm going to make the absolute most of this opportunity. I'm not going to let this pass me by. So I didn't struggle too much with motivation, a little bit of performance anxiety going into exams, but I had really good support from my university. I was able to identify that, and actually it made a big difference to how I then approached exams. Before understanding that performance anxiety element, I would work really hard and maybe not get the result that I worked for. But once I realized that, actually, I can do this, I can breathe, I can, recognize where I'm getting over anxious in the exam, I was able to essentially do much better.
That's brilliant. And you touched upon this about the feeling of finding purpose, and you mentioned Medicine, which of course was a global health student-run organization at the time. You really did explore those opportunities in global health, taking on opportunities in the WHO and the United Nations. Do you want to walk me through how all that came about?
Yeah, so Medicine was fairly easy to get involved in because it was on campus. You could attend meetings, and they also had a national team as well, which I eventually came on to join. And honestly, it felt like I'd found my people, it felt like I also found people who were striving for purpose, who were striving to make impact, who were striving to make change. And one of the most important encounters I had was, he was the medical director at the time, a guy called Cam. If you're listening, hi Cam, haven't spoken to you in a while. But Cam had done an internship at the WHO. And I had applied online and hadn't heard anything, and was just thinking it wasn't something that was going to really happen for me. And I had a conversation with him, and with one conversation, he completely changed my perspective of opportunity in this space. He said to me, he's like, well, it's not that hard. Just email around some of the people that work there and ask if you can do an internship with them. And I was like, I didn't even realize that's something that I could do. I didn't know that that was a thing at the time. And it really took away all of the mental blocks, all of the even like practical blocks into getting an internship. So I just began to spam like everybody. And then luckily someone within a department that I was actually interested in within health systems and financing and took me on. At the time I was doing my BSc as well. So it was the summer after I finished my BSc in global health. And and they took me on, and then it just sort of steamrolled into so many other opportunities. Like I was able to get some publications with them. I was able to, whilst I was there, another friend from university was also doing an internship, and we were discussing about how difficult it can be sometimes to get opportunities in global health. So we created this platform called Global Health Jobs, where you can just find jobs specifically for global health. And that led to more opportunities. And that's how the UN came about. And then the World Bank was the same, spamming lots of people. So all of these opportunities, I really did put myself out there. I can't pretend that, nobody sort of gave them to me. I really put myself out there. I really had to sort of go for what I was looking for. So that's how I found myself in that space. But medicine was absolutely core and fundamental to that journey. Absolutely.
So medicine was the gateway drug into global health.
Absolutely,
And what's really smart about what you did was you created a job platform for global health. And I guess it sounds like you were the number one, user. You no doubt identified a lot of opportunities and then thought, well, you know what? Like, I wouldn't mind some of that myself.
That's exactly what happened. That's how I got into working with the UN Special Envoy. They had wanted to post for, I think they were looking for someone to help coordinate one of the projects they were doing. And I was like, I would do it for free. I'll do it for free. I'll volunteer my time. And I did. I volunteered for a few months, and then they needed somebody sort of on a more sort of permanent ongoing basis. That was a paid role. So I did that. And I think at the time I was doing that, I was just coming out of medical school. So I was doing it at the same time I was doing F1. And I think I did that up until early GP training. Yeah. So we were like final year medical school up until GP training.
You touch upon something really interesting there, which is that you volunteered, you offered your time for free to get the opportunity. And I think this is something that, often gets debated about whether or not you should do free internships, whether opportunities should be paid or not. And I don't know how you feel about this, but my view is that sometimes you do need to take some risks, especially early on in your career. You do have an abundance of time, particularly when you're a student. So it is worth pushing the boat out. And yes, you may be exploited and you might end up doing things that don't lead anywhere. But at least all you've wasted is your time at a point where, you're just studying anyway. So whether it's audits or global health jobs, these are all things that you can actually volunteer your time for and then see where it goes. And in your case, it led to an actual paid job in a domain that you cared a lot about. So, what's your view of this now, after all these years have passed?
I think it really depends on your circumstances. I think you're right. I was a student and just coming up to being an F1. I had time. I didn't have any sort of family commitments. I didn't have kids at the time. I had the time. And in all honesty, it was more of a benefit to me probably than the work that I did for them, because I was working with big global organizations doing really impactful work. And I wouldn't have gotten that opportunity unless I offered my time for free. And so I think it's just weighing up. I mean, I really do believe in paying interns. I do believe in paying, or at least having some kind of compensation for your time. I think it's important. For me at that time, it was more important for me to be able to have this opportunity to be in this space, to rub shoulders and be in rooms with, some of the work I got to do was just incredible. And to think that if maybe I didn't pursue it because they weren't going to offer it paid at the time, you know what I mean? And also it's a really good opportunity for people to kind of get to know you and what you can do before you actually go for something like a paid role. It just meant that I could build trust, establish relationships, and I could learn, even if it didn't lead to anything paid, which wasn't my intention initially. Obviously the fact that it did was a plus, but it wasn't my initial intention. People can get to know you, and even if a paid role doesn't come from it, there was no experience that's wasted. I don't believe that.
Excellent. With that mindset, definitely. So then so far we've talked a lot about your experience as a medical student. Where did, graduation and becoming a junior doctor fit into all of this?
It was there in the background. I mean, by the time I got to my final year, things started to ramp up a bit. Obviously as it does. Final year exams at King's, we did them in our final year, and then prepping for F1. In the same year that I started F1, I also got engaged and bought a house, and coming into this new sphere of adulthood, basically at that stage. So that was a really particular time, and I started to realize that actually medicine, I'm not a student anymore. This is F1 and
Mm.
F2. This is work. This is real work. So I did start to struggle to balance all the extra things and interests. And so I had to make a decision. And I think it was the right one at the time to focus on the medicine.
Yeah.
Because the work I was doing, this is essentially life and death. It's essentially like, the day-to-day, needing to be switched on, needing to focus on my progression in medicine. I took a slight step back for those sort of, maybe after F1, F2 to GP training, I took a little bit of a step back. And I don't regret it. I think there are different phases and seasons for different things. And I think that was the right thing to do at that time.
Anyone listening to the story up to this point would assume that you then go on to, have an illustrious career in global health. But you ended up doing something quite different. So you ended up going into occupational health and doing a range of other things. So why did you make that decision?
I don't even know if I can call it a decision. It didn't feel that way at the time. I didn't realize that. I didn't know what I was creating when I was pursuing occupational health. So I did the diploma for occupational medicine whilst I was a GP registrar. And I'd had this sort of knowledge of occupational health for some time, but I didn't really know too much about it. And I remember speaking to a doctor who works in the UAE, and my husband and I were thinking, oh, should we move to Abu Dhabi, should we move to Dubai or something like that? And he mentioned that if you want to move, it's good to have a niche, it's good to have something sort of specific. So I started to look into what that could be at the time. And he'd mentioned a few things. He'd mentioned diabetes, and I thought, oh, thank you. He'd mentioned aviation medicine, and I thought, even less so. And then he mentioned global health, and not global health, occupational health. And actually, occupational health is something that I'd seen around and I'd heard of. And I thought, oh, why don't I sort of look into this a bit more? And I did. And I was so pleasantly surprised as to what was under that thing that I'd been hearing about in the background, but never really looked into. So I did my diploma, and then I went on mat leave, basically. I did my diploma and I went on mat leave. And I did my exams whilst I was on mat leave. And then it was due for me to come back into work. And at the time I was coming back into work, opportunities for GP work had greatly diminished. I'd been working as a locum before going into maternity leave. And so I was sort of limited in what I could do anyway. The opportunity wasn't there. So I applied for some roles in occupational health and got them. And it has been such an incredible experience. The beauty about occupational health is that we've spoken about purpose, we've spoken about meaning, and at the center of all of that is the person, right? It's the individual. It's the privilege we have as doctors to get into somebody's life and make a difference one way or another. And occupational medicine allowed me to do that in a way that no other stream of medicine I'd seen could do. I'm able to look at the whole person. I'm able to look at how it impacts their day-to-day, how it impacts their work, how it impacts their relationships, their lives. And try to find ways and measures to support their employer, to support them. And it just feels like such a unique privilege, but it felt like it was designed for me, basically. It felt like the work that I was meant to do. And I really love all of the occupational health work I do. I just find it so rewarding.
And then at that point, where did global health then fit into the grand plan? It sounded like you really found your specialty, but what about all that past experience?
Yeah. So like I say, I don't believe any experience is wasted. I really don't. I mean, I had, all this great work and opportunity, and I did my BSc in global health. And I've taken so much of that into all of these spaces. So much of that, so much of the needing to understand strategy, the needing to understand systems, the needing to understand how health financing works. I've taken that into occupational health. I've taken that into my role as associate medical director. at Kent Community. At the heart of most of the work that I've done is people, right? Right at the center, like I say, is the individual, it's people. And once you learn how to present, once you learn how to speak and communicate and get people interested and get people engaged, that really is that's the tool that you take everywhere. It's the key you take to open other doors. So none of that experience was wasted, especially not a lot of the time that I was doing work in global health. It was so much coordination, so much management. And now I can see just how valuable all of those tools that I learned were. So I know we talk about transferable skills and soft skills, and it can kind of feel a little bit wishy-washy, but I can see in actual practice how all of that time was not wasted. And I've just been able to transfer all of those things into the work that I do now.
But let me press you, because that all makes sense to me. You gained a bunch of skills and you applied them to occupational health. But then why didn't you stay in global health? Thinking strategically, if I was a trainee with this wealth of experience, WHO, UN, I'd be thinking, how do I become the medical director of the WHO, let's say?
Yeah.
As a track, I'd want to build on those foundations. Why did you not see it that way?
If I'm being really honest and being really transparent, I was getting a bit frustrated with global health. I was getting a bit frustrated with talking about the issues. I just wanted to do something. I wanted to do something. There are I've worked with some really great organizations who are really doing some things. Some of the work I did with the UN was around setting up the Financing Alliance for Health, which is they're like technical experts in financing strategies, and they support African governments, and they do incredible work, really, really great stuff. I didn't have the time to invest in becoming an expert. And actually, I've never wanted to be an expert in anything. I'm really happy being a generalized specialist. That's my favorite place to be. And I think with global health, if I wanted to keep going, I felt like I needed to specialize in something, or I needed to become an expert in something in order to be able to affect that change. And the other part of that is that I really started to enjoy clinical medicine. It was a shock to me. It was an absolute shock to me. I had no idea that I would be interested in clinical medicine because, like I said, I spent all of medical school avoiding medicine. But I loved speaking to patients. I loved being able to make a difference, the diagnosis, the management. I really, really enjoy that work. And so it wasn't even much of a pivot. I just sort of went with where the interest was, I had an interview, I won't say for which role, but I had an interview, and they asked me, because I was talking about all these different things that I've done, and they were like, who is this person and why are you here? And so in the interview, they asked me, they said, what's your ambition? And I said, I don't have a singular ambition. I want to work with good people and do meaningful work. I just don't, it's not important to me where that is or what the space is, just the right time, the right people, and doing really meaningful work is what I'm interested in.
It's so great to hear that, the way you describe it, because in today's climate, there's so much negativity. A lot of medical students, pursue all these interests because they want to become the professor, consultant, and then they get to clinical practice and they become completely burnt out and jaded by the system. Whereas in your case, you were pursuing all these interests because you were unsure. It sounds like right from the start, but then when you actually got to the patient, that's when you started finding your joy, and that's where, you were getting your reward. So I think that's, it's great that there are still examples out there where that is the case, because you can imagine a lot of the audience and a lot of the guests that we have on this show, tell the exact opposite.
Yeah.
So that was the journey to occupational health. And then, of course, you took on a prominent role in Kent Community as Associate Medical Director. So how did you find yourself there? And especially, I guess, from the background of general practice, how did that happen?
I don't know. I really don't. I have no idea how that happened. When so this again was whilst I was on maternity leave, and I was looking for the next role. Like I said, there wasn't much GP work. So I knew I had some occupational health work, not a lot. And I also work as a private GP, but that was just for one morning a week. And so I was looking for what would suit me best. And like I said, I want to do good work with good people. That's what I want. That's what I want from my career. And I came across the job description. I just thought, oh my goodness, this is everything I want right now for what I want to do. This is where I want to be. And I was so anxious about applying to the point where I couldn't even discuss it with friends because I just so nervous about applying. I was like, I really want this role. And so I went for it. And I remember spending all of my birthday, because it was around about the time that the deadline was due, spending all of my birthday. My husband asked me, what do you want? And I was like, can I have a day to work on my application, please? I really want to sit down and write my cover letter and make sure it's perfect. So yeah, so I applied. And I think, although you'd have to ask them, but I think it was the blend of experience, the general practice and all of that helped me to get the role. It's all those transferable skills that I can't ever put down my work in global health because it was also so useful. And yeah, here we are today. I'm still, working out why I'm here, but it is one of my favorite roles for sure. It is definitely incredibly rewarding. Kent Community, I mean, I'm obviously biased because I represent the trust, but it is just an incredible place to work. It's a really great place to work. And it's really nice to do sort of this blend between, it's not general practice because I don't work clinically in this role, but this sort of like community-based health. And obviously we know that that's become more of a priority even on the government's agenda, which is good because I think it's a long time coming. But yeah, it's been a really rewarding role and I'm really happy to be here.
So let's explore that a bit more, because I'm sure a lot of the audience will be interested in learning more about how, as relatively, early on in your clinical career, you were able to land into an executive role in an NHS trust. When I think about NHS executives, I think that, they've done years and years of clinical and managerial work before they then get these kind of roles. I suppose when you saw that, did you have any imposter syndrome or any, did you ever feel like, oh, do people at my stage get these kind of roles?
Of course. Absolutely. Absolutely. I remember being like, there's no way I should apply for this job that I really want so badly. And I came to the conclusion that the worst that could happen is that I didn't get it. And I already didn't have it at that time. So I had nothing to lose, literally nothing to lose. And that's generally the approach I take. I have nothing to lose by going for it. If I don't have the role now, the worst that could happen is that I don't have the role after. That's about it. So I thought I'll just go for it. And this is why I don't diminish some of the previous experiences because if I hadn't created all of that sort of mileage, I guess, in global health, that perhaps then I probably would have just been medical school, foundation years GPs. I would have just been like, with the years of experience I've had clinically in comparison to someone who hasn't done all the other global health work. That's all that I would have to my profile, right? I just have the clinical years. But because I invested so much time in global health, so much time in working in these big organizations and that kind of thing, it came to speak here. And actually, the good thing about the role is that it doesn't require years of clinical experience. It requires a bit of strategic thought. It requires good communications. We work a lot with our partners in the system and that kind of thing. And that's the priority, more so than, having been a GP for 20 odd years, because I don't know how much of a difference that would really make to the day-to-day of the role, if you see what I mean. So not to diminish that at all. I mean, obviously, having more experience as a GP, you're exposed to more in the system, you're exposed to more just generally working with partners. But I think for me, it was like, I'm just going to go for this. And hopefully they'll see that this is something that I can do. And this is something that I can hopefully do well. I think they'll say I'm doing okay. That's that's the general feedback. I hope it's going well. I think so.
Yeah. We'll ask them later.
Yeah.
But what does your day-to-day look like then? Because it must be very different to being a GP.
My day-to-day as associate medical director, or just in general? Because
just as an associate medical director?
Yeah. So, gosh, I wouldn't even know where to begin. So my role mostly is to support and deputise for the chief medical officer, who's incredible and does so much great work. And she, so there's two of us that work as associate medical directors, and we sort of share the portfolio of work, and that ranges far and wide. So we have around 50 odd doctors at the trust. But there's still lots of medical work that goes on. One of the roles that I've taken on is to deputise as sort of become like the Deputy Chief Clinical Information Officer. So that has really just opened up so much, I guess, opportunity and so much work for the digital space, which obviously is huge now. We've got lots emerging with AI and automation and all of these processes. So That's been a big chunk of my work. Also coordinating with the local medical council, with other GPs in the area, working with across services for lots of different things, medicines optimization, like the list is honestly
Wow.
endless. Obviously working with the doctors, looking at ways that we can increase sort of capacity and leadership within our teams. Yeah, it's extensive, but I like that. I like the variety of the work it brings. I like that it's different. I like that it's interesting and it's important. So yeah, that's kind of what my day-to-day looks like at the moment.
And how do you balance that with your other ventures? Do you do this full time, or are you still practicing as a GP?
So my week is Mondays, Occupational Health, Tuesdays, Associate Medical Director, Wednesday morning, Private GP, Wednesday afternoon, Associate Medical Director, Thursdays, Associate Medical Director, Friday, Occupational Health. So I have there are 3 roles across 4 different organizations. I don't know how long I'm going to do that for, but that's what I'm doing at the moment.
Yeah, I mean, wow, you are
Yeah,
keeping very busy.
just a tad, yeah. When you throw in the MBA, it really is just a party at that point.
And of
Yeah.
course, we get onto the MBA. So, what was your motivation then for taking on the MBA in UCL?
So I really wanted to continue learning and wanted to continue sort of like further education. And I had applied, this is slightly embarrassing because I applied for so many different programs, like over the last, before I found out about the program at UCL, probably 3 or 4 years before, I had applied for everything. I'd applied for several masters in public health, masters in global health, other MBA programs, and I got into them, but I never proceeded because it just still didn't feel quite right for me. I didn't know what I was looking for, but I definitely didn't want to just do a master's in public health for the sake of it, just because that felt like the natural thing to do because of my experience in global health. I didn't want to waste my time. I wanted to learn something new. And then when I came across the MBA, so I actually applied for the first cohort and had to defer to the cohort I'm in, which is the following year because I'm a maternity.
Mm.
When I came across the program, I thought, finally, this is a program for me. This has beautiful intersections between medicine and
Mm.
business and global health. And at UCL, it's such an ideal location to house this program. And so it really had the curriculum, everything. It had everything that I'd been looking for in further education. I wanted to learn about strategy. I wanted to learn about marketing. I wanted to learn about economics and that kind of setting, but not just from a health perspective, but with a health foundation. I wanted to be around like-minded people, and that's exactly what I have with this program. The rest of my colleagues are just, if I was a med student, I would be sending like cold LinkedIn messages to every person on the MBA because I work with some incredible people on that program doing really awesome stuff in healthcare. So yeah, it was so exciting to be able to come across it and to be able to get in and study it. We've just finished our first year. We've just submitted our group project, which went really well. So I'm looking forward to what next year has to bring.
So you're balancing an MBA with 4 roles at the moment.
Yeah.
I
It's
mean,
summer, so I have till October.
fair enough, fair enough. But you've clearly got a lot of exciting roles and opportunities on the go. You kind of mentioned that you might not do this for the long term. Do you feel like it's still balanced well, or do you feel like something will have to give soon?
I have 2 young children, 2 girls, aged 3 and 1, and they run circles around me, I tell you. And at the moment, it's balancing fine, very organized. I have to be with this,
Hmm.
with this setup, and so I have to stay on top of things. I'm quite organized, which is, I think, a good skill to have. But just as my family develops and my kids grow and that kind of thing, you kind of have to decide what your priorities are. To be honest, I'm quite happy to stay as I am. It's just working 4 part-time roles is not working 4 part-time roles. It's working 4
Yeah,
full-time roles, basically. You know what I mean? It's kind of working 4 full-time roles as you go along. And so I am just mindful that I don't want to, I want to make sure I do all my roles well.
of
I'm still
course.
keen on, I'm still keen on excellence. I love variety, but I still want to do well in all my roles. And some of them require more attention than others. and require my presence and my time more than others. So yeah, I'm just going to go with the flow and see how it goes. I think the exciting thing is that once you start to design your career, you're not scared again. I'm not scared to, okay, I'll take that off for a while and maybe I'll add something else in, or maybe I'll move this around. And that's what it is. At the moment, it just feels like a mismatch of lots of different things. But to me, it all perfectly feeds into my personality and into my drive for purpose and meaning. And yeah, so it does make sense to me anyway.
And so we come on to present day. Tell me a bit more about your latest venture, Occuvia Health.
Yeah, so Occuvia Health so I work for two other organizations doing occupational health, and they're both fantastic organizations, really, really great organizations, very supportive. But because of the experiences I've had with, all the global health work I've done, there's a whole bunch that we haven't spoken about today. Like I do some other charitable work and work with some schools and things like that. I think I recognize that there was a niche that sometimes gets forgotten in charities and NGOs and these types of organizations. And actually, the need for occupational health is probably just as high, if not higher. I mean, when we talk about occupational health, people tend to just think, hard hats and construction work, or, working at heights and that kind of, safety critical work. But actually, there's a whole world to occupational health. A lot of it is mental health related, stress and burnout. And what do you get when you mix someone who is super passionate about their work, right? And wants to just do everything because they care so much. But actually, the constraints, the funding, the time doesn't always match with their passion, And you end up getting people who get burnt out. You end up getting people who are overburdened and stressed out. And so I wanted to create a niche that supports those people directly. A familiar, friendly face who understands some of these challenges and can help give your employer some support, or help employers to work how they navigate their employees with these particular health issues. Charities have small teams. Often they have people who are trying to do several roles at once, like me, basically. And so trying to, and actually just, anyone that's worked in the NHS knows that too, working extra because you care, because you're interested, but also that comes sometimes with a price to pay. And so just making sure that we can support people at work and stay healthy at work is something I'm really keen about. So that's where Acuvia Health came from. I'm still in very early days of building. I've had a few clients so far and it's gone really well. So watch this space, is still going, but so far it's been really positive feedback.
Brilliant. And the early stages are always the most chaotic and arguably the most fun as well. In all the previous roles that you've been in, you've done a range of different things, but this is your first startup. What were the emotions like? What was the thinking in starting the business? Was this very daunting for you, or did it feel very natural?
So it's interesting, it's not actually my first startup, because I did global health jobs.
Oh yes, of course.
And then I handed that over to someone else because I couldn't do it anymore, because I needed to do F1. So I was like, I can't do both. And I also, when I was working with the UN and Financing Alliance for Health and things, I had my own company then too.
Oh.
And actually, so I took some skills like website building. So I created the Occuvia Health platform, which is actually quite intuitive, and people can submit referrals, and it's more than just meets the eye. Obviously, there's the front stuff that you can see, but I can get referrals submitted. I can get pre-employment health checks submitted on the platform, which most occupational health providers have to outsource. They have to get software from someone else to do that, but I was able to build that out myself using AI, using technology. And so the daunting part for me wasn't the building of the platform. It wasn't even the idea itself. I think the daunting part for me was realizing that I had a business and I needed to sell myself, and I needed to sell what we had to offer. And that was the hard part, because I'm a doctor, I'm not a salesman. So learning those skills, learning how to sell, learning how to engage with clients, I think has been that's been a new skill. But actually the MBA has helped with that. We've learned about strategy, we've learned about marketing, we've learned about working with people. And so I've been able to use some of those skills in sort of navigating how I go about getting clients and working with employers at Acuvia Health.
And why now? Because it seems like a recurring theme throughout our conversation together is that you're spinning a lot of plates. You're doing multiple part-time roles. You've got 2 kids. You're doing an MBA, and now you've just pulled the trigger on a early stage startup. Like, you're truly a glutton. Like, I mean, this is a lot. I mean, even I'm pretty bowled away.
I mean, when you say it like that, yeah, it sounds like a lot, I'm sure. Why now? I'll answer that question first. Why now? Because I just want the flexibility it brings, and I'm really hoping in the long term, I'm able to build it into something that I can get other people involved in. I want to be able to create opportunities for others. I want to really be as supportive as possible for some of these charities and smaller teams and these NGOs that don't have that in-house support. And in all honesty, it's a passion project. That's what it is. So I'm really fortunate that I work in all these great jobs. I'm really fortunate that I have these roles. I always say I have 100% job satisfaction. I genuinely do. I love all of the jobs that I do. But Occuvia Health feels more like a passion project. It feels like something just for me, something that I can sort of put my heart into in a different type of way and express creativity in a different type of way that you can't always do in other roles. So yeah, I think that's why now. I wanted a way to be able to express this interest and express this passion that I have. And as for spinning all these plates and juggling all these things, in all honesty, it just suits my personality. This is how I was in medical school. Like even at medical school, yes, all the global health work, there was charitable work. Throughout the course of being a med student, I had 11 and a half part-time jobs, not all at the same time, but throughout the course of it. I had part-time jobs constantly. I was always working. I was doing med school full-time. I was doing global health work. I think I've just adapted into this person who just can't sit still and do one thing at a time. And in all honesty, I think it's where I flourish the most. I think you have to know yourself. Like, yes, sometimes it's a bit overwhelming and sometimes I'm like, oh my gosh, do I have too much on? But I think I thrive the most when I get to live fully and I get to do things fully. So that's been my experience so far. I know it sounds like a lot. It does feel like that sometimes.
No, it's genuinely so impressive that you're able to give it your all, be still true to your values whilst also pursuing all of these interests. It's super impressive. So unfortunately, we're running out of time. So I'm going to ask one last question, which is, what practical advice would you give to other students or clinicians who are looking for alternative careers, less trodden paths? What kind of advice would you give them?
Maybe two things. The first one is to design your life. We don't always get taught that in med school. We don't always get taught that as clinicians. We're taught that there is black and white and medicine is as much an art as it is a science. And so being able to express creativity by designing the life that you want, I think is so important. I think it's so key. You can have the opportunities that you want if you go for them. And I guess that would lead on to my second bit of advice, which would probably just be that it's what I said earlier. The worst that can happen is you just stay where you are. That's the worst that can happen. If you're considering an opportunity, if you're considering volunteering, if you're considering exploring a new specialty or going for a job role, the worst that can happen is that you don't get it. And that's it. That's all that can happen. You don't get it. The best thing that can happen is you do get it. And then you've now opened up a new part of your life. So yeah, I'm just so big on like going for things, go for the scary things, like me coming on this podcast. I was saying to you that I haven't been on a podcast before. This is the scary thing. And I thought, yeah, okay, I'm going to do the scary thing. I'm going to do the thing that, I wouldn't usually do, but what's the worst that can happen? And so far it's been okay. So
yeah. Well, I'm so glad that we've managed to debut you on this show. No, that's brilliant advice. That's all the time we have for today. Thank you so much, Victoria, for joining us today.
Thanks for having me.
And for those listening, if you like what you hear and want to support the show, please do like and subscribe to us on Apple Podcasts, Spotify, YouTube, or whatever podcast platform you are currently listening to us on. It'd mean a lot to me, and it would help us spread the message to others exploring alternative paths as well. So thank you for joining, and see you next time.